Good day, class. Thank God we are here again. Today we'll be looking at professional development for nurses. My name is Linda Asamoah, a lecturer at the St. Carol School of Nursing in Accra. So, professional development for nurses. The course entails leadership and management principles and then some theories. And as you know, when you finish the course degree in nursing, you are automatically in a leadership and managerial position. So there's the need to know a little bit about management in nursing and then leadership issues in nursing. And also it is also good to know about the health sector because you'll be working within the health sector in Ghana. So we'll also look at the health sector in Ghana, what entails, which other agencies forms the health sector. So for today's class, we'll start looking at the national health system. So before we start, there's the need to do a little bit of definition. We'll define certain terms, and then the definition will help us to, or situate us to understand the course better. You realize that we are talking about health system. So we'll start by defining what a system is. And then we'll also look at what a health system also entails. So by definition, a health system, is a group of interacting, interrelated, or interdependent elements forming a complex whole. And then you realize that when you are talking about system is not just one unit. By this definition, it makes up of different units, but the units do not stand on their own, or they are not stand alone. They are supposed to interrelate, and then they also interdepend on each other, so that when one side is not functioning well, the whole system or the whole organization will lack or will be deficient. So that is what system is. It's a group of interacting, interrelated, or interdependent elements. And all these things forms a complex whole. So when you look at health is a system. Health is made up of different professional groupings, different disciplines, and then they all come together and they make a complex whole, which is health. And the same way when you look at the human body is a system in that it is made up of different organs, different parts. And all these organs and parts, they are supposed to interrelate, and then they also depend on each other, and then you have that complex whole as a human being or as an individual. So that is a system. And then even when you go to the hospital, you take a single patient that you are attending to. That patient is a system. Once a part is not working, it affects the whole body. For example, when you look at your eyes, if something falls inside your eyes, you realize that you start having running nose. And then at times it can also lead to headache and all that. So you see that there's that interconnecting between the two. And then it's said that when one side is not functioning, the other side can also not function. So within the health sector, or when we talk about health is a system. It's made up of different parts, different organizations coming together. So you take the health sector, it's a system. Health sector is not just the Ministry of Health. Other sectors also come in, and then you have one complex whole. For example, education, works and housing, they all have a role to play. And then at the end, we'll have a complex system. You go to the hospital again, one patient, when you start from there, you have people taking the details, the records people will be there. And then from there, the person goes to the consulting room where you meet the doctor or the medical officer. And then the medical officer over there could be a nurse also there. And all these people have a role to play. So after doctor has made the diagnosis. Initially, we call it a provisional diagnosis. And before that diagnosis can be confirmed, so that you can say that this person has for example, hypertension or malaria, you have to go to the lab. You have to go to the lab. And then the lab person will also do the lab analysis. And that is where you can really confirm the diagnosis. So a doctor cannot work without a nurse. A nurse cannot work without the lab person. And up from the consulting room, if there's the need for the patient to be admitted, on the ward, the nurses are there to take care of the patient. If there's the need for any medicine to be administered, the person will have to be referred to the pharmacist. So you realize that all these different professional groupings, they all play a role. They all play a role. And at the end, you have a whole system running. So that is a system. When we say a system, it's interrelated, interdependent, or connecting complex elements, and then they are supposed to form a complex whole. So when one side is not functioning well, the whole system can also not function well. Then we'll look at what health system is. We'll look at about 3 definitions. There are so many definitions, but we'll look at a few of them. According to Murray and Frank, health system includes the resources, actors, and institutions related to the financing, regulation, and provision of health action. Resources, actors, and institutions. You know what resources are. There are 2 or 3 types of resources. You have the financial resource, you have the human resource. I think there are even 4. When you add time to it, time is also a resource. So you have the human resource, you have the financial resource, and then you have the material resources. So Murray is saying that when you talk about health system, it includes all these resources. And then the actors, the stakeholders. The actors are the stakeholders. And the stakeholders could be the health professionals, service providers, even the patient themselves, anybody that has a role to play in health. And then the institutions, you go back to the hospitals. You need hospitals, you need facilities to be available. And all these things should be relating to the financing. So you are looking at financing. How does the health or the system get funds for their running of their activities? So you have the financing, and then you have regulation. There are so many laws internationally and locally that also regulate the practice of health. There are so many policies that come together to regulate the way health professionals are supposed to work. So according to the Murray, resources, actors, and institutions relating to the financing. So all these things should be related to how you finance, and then you regulate, and then provision of health actions. So that is it for, that is how Murray and Frank, that is how they see health system. And then you also have Roma. Roma also define health system as the combination of resources. So you realize that the resources have also appeared here. It's a combination, they are saying that it's a combination of resources, organizations, financing, and management. The organization is talking about how the health system is supposed to be operated. At what levels do you organize your care? In Ghana, we have 3 levels. You have the national, you have the regional, and then you also have the districts, and then at the districts you have the sub-districts. But basically we have 3. We have the national, and the national, at times we term it as the tertiary, and the regional becomes the secondary, and then the district going down is the primary. So they are looking at the levels of care. And also you have financing and management that culminates in the delivery of health services to the population. So you need the resources, you need to organize the resources, the levels that you do the organization, and then how you also finance and management. The management is talking about the day-to-day running of the system. the health system, if you are at the facility level, how do you manage the system or the facility in your care? So that is it. And then financing, you realize that in Ghana, we have the GOG, what we call GOG, Government of Ghana funds. And then you also have internally generated funds. And then you have the funds that we get from the donors or the partners. And all these things, it should be combined. We combine all these things in the delivery of services to a population. So the services that you are delivering, it should be tailored towards serving the need of the population. And the population could be anybody living in Ghana. And then you have the WHO. In 2007, WHO also came out with a definition for what a health system is. According to WHO, it consists of 4 organizations, institutions, people and actions whose primary intent is to promote, restore, and maintain health. All organizations, all institutions, people, and actions. So all these elements, if the aim is tailored towards promoting, restoring, or maintaining health, then you are part of the health system. You know what the institutions, so many institutions come together when you talk about delivery of care. I may even mention the education, health sector, and all that. If their aim, they have their primary intent is to promote, restore, and maintain health, then they are part of the system. Then you also have the people. And then you have the actions. The actions can be the services that you are providing. It can also be the policies and other things. And you should know that at the end, all it should be geared towards promoting, restoring, or maintaining health. Then we'll also look at health system versus healthcare system versus health system. We tend to use these words interchangeably. But if you are a leader, you are a manager, you should know the difference between the two. So healthcare system is a means of organizing social response to the health condition of the population. Healthcare system is a means of organizing social response to the health condition of the population. We've already defined what a health system is. But a healthcare system, according to this definition, is a way, is a means, a conduit by organizing social response. How do you organize social response? The mobilization of funds is also part of it. Going for, at times, for example, even students, when you are celebrating your student week, you embark on certain health activities. It's also part of the social response. Churches, at times, they go and donate or adopt a ward. They are all, a ward in a hospital. They are all part of the social response. So healthcare system is about organizing this social response to the health condition of the population, improving the health condition of the population. So you realize that everybody's, you have so many hands on deck. There are so many associations, Rotary Club and all that. They all have, even the media, they are all part of the social response. And they all help in the providing health services to the people to improve upon the health condition of that population. And it is also narrowed than the health system. So health system is broader. It is broader. Can we say that is the canopy? And then under that, you have the healthcare system inside. And it's normally described in terms of the levels of care and organizational structure of the ministry responsible for health. So we are talking about organizing social response. And then here we are also saying that normally it is described in terms of the level of care. When we're defining the health system, I mentioned the fact that we have in Ghana, basically we have 3 levels of care. So that is what they are talking about, the levels by which you organize the care. And then it also depends on the structure of the ministry responsible for health. In other Ghana here, we have the Ministry of Health, which is responsible for all health activities. But you go to other countries, there could be a different ministry that may be responsible for health. For example, when you go to Zambia, they have two ministries. I think they have the Ministry of Health is there, and then they also have the sanitation or water. They have water and sanitation. So you realize that they are different, the levels could be different depending on which country that you are coming from. So when you talk about healthcare system, you are also talking about organizing social response, and then it also talks about the levels of care. And the levels of care varies from country to country, and it is also narrower than a health system. So it's within health system that you have the healthcare system. And then we have what we call health system strengthening. If you say you are strengthening the health system, what does it mean? It's about building capacity in critical components of health systems to achieve more equitable and sustained improvement across health services and health outcomes. I mentioned the fact that when you complete the degree program, you will automatically become a manager or a leader. So you should know how to strengthen your system. What is meant by health system strengthening? And then by definition, it's about building capacity in critical components of health system. You know, there are so many areas within the health system or the health sector. And then you realize that when we talk about critical, you look at a place where we need more people, or once it's not functioning, the whole system is also not functioning well. For example, at a point in time, they realized that the midwives population were just wading off because a lot of them were retiring. Let me say that they became aged. The midwife population were aging, and they were leaving the system, but we needed a lot of midwives. So what do? We have to build capacity, train them, train people in, and then we give priority to that. So if you are trained as a midwife, you are a priority area within the health sector. Because without the midwives, we will not be able to achieve target for the maternal, reducing maternal and child death, or we cannot improve upon our maternal health. So there was the need to train midwives. There was then, even worldwide, there was the need to train midwives. So they have to make midwifery a profession. At first, it wasn't a profession. It was a specialized area within general nursing. But the midwife population were just reducing. They were all retiring, aging. So there was the need to make them a critical component of the health system. So let's make midwifery a profession. You don't need to be trained for 3 years as a general nurse before you go and do another 18 months to become a midwife. Straight away, you can also be trained alongside. And then when you come, you are a professional on your own. And then you practice as such. Even these people, those who fit the limb fitters, at a point in time, they were also, all of them were leaving the system, retiring. So there was, I think, in the 2004, 2005, that way, there was the need to build their capacity. So people were sent to Tanzania for training, so that when they come back, we will know that we have been able to, that side of the healthcare, we've been able to put things in place so that the system can function properly. The same way physiotherapy. Physiotherapy too, I think 2007, that way. If there was the need to train people, there was a need to make it, to hype it, because that side was also a critical component. And people were sent to Netherlands for training, so that when they come, they will be able to improve the outcomes of our health system. So that is the health system strengthening. If you say you are strengthening your health system, Then you are training people, you are looking at critical components. You have assessed your system and you know where you are lacking. And then you train people, you give people staff scholarship to go and study. You build their capacity. It could be in service training. You build their capacity so that you'll be able to achieve that equitable and sustained improvement. And then your system will be able to run smoothly. So that is it for the definition. We will look at the principles of health system. If you mention health system, what are the principles on which it should be based? Or what should be the foundational things that should be in place? Every health system, to start with, should be people-centered. The first principle is equity and fairness. It should be people-centered. Whatever policy, whatever program that you come out as a health sector, it should be tailored to serve the need of people. It should be tailored to serve the need of the population or the client. It should be people-centered. It should be friendly. And then it should also be fair and equitable. You treat people equally. You don't say that this person is rich, this person is beautiful, or this one looks started. It should cut across, or you don't serve the need of one side of the population and leave the other side. A health system should be people-centered and should serve the needs of people. And then there should be fairness also in it. And it should be results-oriented. When you say results-oriented, we are looking at quality. Issue of quality management system for continual quality improvement. You put things in place, policies in place to ensure quality so that people that are accessing your services will have confidence in you. Because when I come to the hospital, I should have my money's worth. When I come, I should not be worse off. I should have confidence in you. I should be cured. You don't go to the hospital and then when you come out with a different thing altogether. Quality improvement, quality management issues is also key, results-oriented. We should see improvement in the health status of people. If you say that our health system is well functioning, then people should be well. You get your money's worth. It shouldn't be that, for example, you go and deliver and then you don't come back. We are looking at where you go and deliver. You come back safe with a healthy baby. That is results-oriented. That is results-oriented. You don't go and then you lose your baby or you lose your life. And then it should also be evidence-based. And evidence-based, we are looking at research. Every health system should be research-based. Everything that you do, the care that you give, there should be a rationale for your activities. Why are you doing that? For example, if you are giving we are doing wound dressing. Why is it that you have to dress the wound, the inside, before you come and clean the outside, but not cleaning the outside before going in? You understand? And then whatever reason that you give, there should be basis for that. If you are treating, you are dressing the wound inside before you come and clean the outside, there should be basis for your action. You should be able to prove that when the inside of the wound is more sterile than the outside. And how do you know that? There should be, you should have done some observation or some little research. So everything is evidence-based. And evidence, because it's evidence-based, we need the technocrats. We need academicians. We need the politicians, the community, and then the local context. And also, we also need change agents. Because, for example, the academicians, when you come to research, they are versed in research. And then they are also training professionals and making the professionals research-oriented. That is why in your schooling, at a point you do patient care, and then you also do a project. They are all trainings that is gearing you towards becoming an evidence-basedness, becoming a researcher. You don't need to go and do special course before you can become a researcher. You also need the technocrats, the professionals. They know the basis of whatever they are doing. And of course, you need the politicians. If you are doing some research, you need the politicians to also fund it. They have to buy into whatever findings that you come out with. And you need the community. The community members, they know their needs. They know their needs. So whatever program that you introduce, if you want the program to be sustained, you need the community members to buy into it. And then their needs is also always based on evidence. It's always based on evidence. You don't sit in the headquarters and then you design a program and you send it down to the, for example, to my village, and you implement and you expect that it becomes sustainable. No, if you don't involve them in it, it will not be. And then you need change agents, because we are talking about research. Research is also geared towards change. And then you need people that will drive that change. If there's a need there's the need to implement certain kind of measures to reorient the system or change it, you need people that will also drive it. So the principle number 3 is evidence-based. And even when people come to the hospital, any care that you give to them, you have to also explain it to them. And they know, if they understand the basis by which you are giving certain kind of treatment, they will always accept it and buy into it. And then it should be community-driven. We are talking about, I even just mentioned, it should be community-driven. It should be based on the needs of the community. The needs of the community is very key. We should be sensitive to the needs of the community. You don't go and introduce certain programs. You start a program at the national level, and then you send it down there when the community members don't even understand why they should do it. Then there will be a problem. You realize that some year back, when we had the bird flu, there was the need to vaccinate people. There were vaccination going on. And that vaccination, there were a whole lot of hue and cry, because people did not understand. And then there was, it shrouded in mystery, all sort of rumor that some people went for it and they died and all that. But if we had involved the community from the word go, sensitize them that there's the need for them to vaccine, you give them the side effects and then the importance of taking the vaccines, there wouldn't have been that hue cry. So community-driven program is key, and that is leadership. If you're a leader, you should be concerned about the people that you are presiding over. The issue of governance. Governance is about ownership, taking ownership. So if you make your program community-driven, then community members will take ownership over it, and then your program will be sustained. And the issue of accountability is also key. In every health system, there should be accountability. Whatever care that you give, you should know that you stand to account for it one day. When the need comes for you to account for it, you should be able to do that. Transparency is also key. So that is why there's the need for information sharing. If you want your program to be sustained over a period of time, the issue of transparency is there. You share information, and then people also contribute to it. And it should also be context-specific. In most Sub-Saharan Africa, the context is synonymous with resource-constrained environment. Every program, the system should be context-specific. You don't go and take what pertains in another region of the world, and then you bring it here and you implement. It may not work, because even some diseases are also based on the climate, the environment, and all that. So if you just go and take other programs that, at times some of the programs that WHO even designed, if you take them hook and sinker, and then you want to come and implement it in our context, it may not work. And here they are saying that within the South Africa, especially south of the Sahara, we have a lot of resource constraint. We are looking at the money. Do you have what it takes to implement the program? And after implementing, do you have enough funds to sustain it? Or is it that you introduce it today and then tomorrow it is not there? So you are looking at a program that would be suitable for your context as Africans, based on our culture, our way of life. The program, the health system should be context-specific. What pertains in Europe may not work in here. So that is it. Even when you look at some of the, as I said, some of the diseases over there, we don't find it in our sector. And some of the diseases here too, we can also not find them there. For example, there's no way that you can contract malaria in Europe unless you took it from Africa, from a hot climate area. So these are the things that we are talking about. It should be context-specific. Other than that, our program, our system will not be sustainable over a period of time. Like President Kufuor's time, he introduced free maternal care. Because in other areas, free maternal care, it's there and it's running. But you realize that when he left power, that policy is not working properly. Did we look at the fact that do we have enough funds to sustain that? It was a good policy, so that when you are pregnant, throughout your pregnancy to the time that you deliver, you don't pay anything. There shouldn't be any charge. But is it working now? So these are the principles that every health system you have to look at. Then we are looking at ethically sound. The system should be ethically sound. In making the system ethically sound, we are looking at human rights issues. Human rights and dignity, safety for clients, community, and environment. We are looking at human rights. Whatever program that you are introducing, you should have at the back of your mind that you are upholding the rights of people. You are not going to infringe on the rights. And you should also know that the people that you are giving care to, your clients, they all have some dignity that need to be upheld. So if somebody comes and the person is in tattered cloth, you don't look down upon the person or discriminate. The person may have a right. We all have the right to information. So if you are giving me care, I have the right to know, understand the rationale underlying what you are doing. Why are you giving me care? If you are giving me insulin, you are injecting me. I know some people get diabetes. They don't take injection. They just take tablets. So why is it that I should take injection and not just tablets or use food to manage it? You need to give people information because they have the right. And then if you are not care, even now, people have started suing the people. You know what happened in Konfanoche some time ago? The woman went to deliver, and then the baby died. But when they found out, there was no indication that something of a sort has happened. So these are the things that we are talking about. You should know that people have rights. Because I'm an illiterate doesn't mean that I don't have any dignity. Then you are also looking at safety for the client. The care, the policies that you are bringing up, it should be safe for the client. For example, this COVID, the vaccines that they want to bring, is it going to be safe for us, for the client? So these are the things. Ethically sound. If it's not safe and then you give it to people and they come out with adverse or serious side effects or reaction, then they have every right to sue the system, to sue the health sector. So the policies, the programs should be safe for clients. And not just clients, even the community. How do you dispose of your waste, your medical waste, into the environment? Is it going to affect them or is it going to improve? So ethical issues is also key. It's also a principle of every health system. And then there should also be system thinking, a holistic view of the health system. We just define what a system is. And then I also mentioned the fact that health is also a system. So you don't just take one side and leave the rest. You should tackle, if you are looking at health, you should have a holistic view. Tackle it as one complete whole, one complex whole, because you don't go in and take care of one side, and then tomorrow you have to also go in and take care of another side. It's a holistic thing. It's a complete thing, a complex system. So you take the health system as, you take it as a system. You have that system thinking at the back of your mind. If you are taking care of a patient, see the patient as a complete whole, a complex whole. You take as a system that even though the person is presenting with just malaria, other sides or other organs may also be affected. You understand? Other organs may be affected. So you look at that. Even the same way, the COVID, when it started, they said it's like present like flu and other things. But later, they realized that not just that. It has to do with DIC, disseminated intravascular coagulation. You understand? So there's also blood clotting of the blood. And the clotting of the blood is not just one side. It goes into intravascular. So it goes into the whole body. All the vessels are part of it. And that is what is killing them. So you look at health, we are looking at, if you say health system, we should have that system thinking. So now, if somebody presents with COVID, you know that you are looking at the person as a system. You have a holistic care of that person. Then we also look at the context of health system in Africa. I even just mentioned that the context is synonymous with poverty and resource constraint. So we'll look at in details some of the things that makes our system, the context in which we find ourselves. We have these 5 things. We have the organizational arrangement, economic context, sociocultural and political context, legislative context, and the main actors in the health system. So for the context in Africa, we'll look at it along these 5 lines. And the first one, the organizational arrangement. We have the centralized system, health system, and then the decentralized health system, and the organizational level of the system. And for the centralized health system, so these are the system that we operate. It could either be centralized or decentralized. So depending on whichever country that you find yourself, your system could be a centralized system and a decentralized system. And if it's a centralized system, these are the features that you see. Yeah, everything is a top-down. You have that top-down approach. Decision is made at the top, and then it trickles down to the lower level for implementation. So if you're at the lower level, you are not involved in decision-making. Yours is to implement. After the powers that be have decided, then they bring the policy down for you to implement. For example, if you're a nurse at, let me say, Botiano Health Center, you're a nurse at the Botiano Health Center, and you need an issue to be addressed. It has to go to, at your level, you cannot do it. You have to send it to your district level. Where do you have your district? Then from there, it goes to the regional before it goes to the national. And the final decision comes from the national. And then it passes through the same system before it reaches you. So even if you want to go for further studies, maybe you're a nurse and you want to go for further studies, the final decision will have to come from the top. And then it makes the system very bureaucratic, because you see that the authority is centered at the top. Those lower don't have much authority. And there's this bureaucratic issues in there. Because look at the level by which you have to pass through before a common decision can be made. There's so many bureaucracies there. You go and see this person, the district director will have to add a letter, the region will have to add a letter, and when it's coming down, it's the same way. So the centralized system has a lot of bureaucracy, and then authority is also concentrated at the top. And there's minimal community involvement. There's minimal the community level, the lower level, you are not part of decision making. Yours is to implement. You don't know the rationale for that decision or that program to be introduced. Yours is to implement. And then you have vertical program. So you realize that the same program, different people can be running it at the same time because there's no coordination. There's minimal community involvement. So those at the top, if you get funding for this program, then you think that I should go to this district and run that program. And in doing that, you realize that another donor has also given funds for the same program. So you realize that the same program could be running concurrently. So that is a vertical program because the decision is centered at the top, and then community members are not involved. You have this vertical programming within the system. So that is it for the centralized system. And then you have the decentralized system, and it's the direct opposite of the centralized. Here, the decision-making starts from the lower level, and then it goes up. So you realize that community members are part of the decision-making. So if the health sector wants to introduce any program, somebody at least at the lower level is part of taking that decision. And because there's that community, there's active community participation there. Because it's a bottom-up approach, the community members are involved. And because you have, as a community, you have your member on the board to take that decision, when the program is introduced, you own the program. There's ownership. You take the program as your baby. And then because you own that, there's ownership, effective ownership. There's also sustainability. I did my service in a village in Central Region. And then when we went, they had this borehole. But we realized that the community members don't fetch water from there, rather a stream, a small stream. And in that stream, they bath, wash their things inside. Animals also go and drink inside. And in fact, when you fetch the water, it's as brown as something. So fresh people, cis farmers, and then we think from Accra coming. So when we got there, these people, you have the borehole, and why are you not using it? So one day we went to fetch, and the borehole was as clear as anything. We didn't ask anybody. And then because we also didn't ask, nobody also told us anything. And we fetched the water. And then we left some. When we went to school and we came back, the water has rusted. So who wants to poison us? In fact, we were scared. We just poured it away. We went for another one. Within a few minutes, hours, it has rusted again. So we didn't know. Then later, where we were staying, the landlord called us and told us that, the borehole, this is the problem they have with it. That is why they are not using it again. And then because those who made the borehole, they also didn't involve the community members. You understand? If they had, they would have known that the iron level of in that soil was high. So there was no need to site that borehole there. So that is it. The community participation involvement is very key, and it leads to ownership and sustainability. And then there's also horizontal programming. Like I talked about the centralized where you have the vertical. The horizontal, because the decision is coming from, you know the needs of the community. So if you are introducing any program, it is based on the needs of the community. And there's no way you can have two programs being run at the same community at the same level. And it also has to do with the primary healthcare program. You know the concept of primary healthcare. Primary healthcare basically is about getting healthcare to the doorsteps of people. You understand? So based on their need, you know what they need, and then you can send the healthcare to them at their doorsteps. And you know that everybody owns the program, everybody is part of it, and then they take care of it because it becomes their baby. Then you have the levels of health system. The levels of health system, I talked about it from the beginning. Basically, or genetically, this is what, generically, this is the levels that we have. We have the tertiary. And depending on the country where you are coming from, the tertiary, some call it the central or the national level. And then you have the secondary, which is the regional, provincial, or the county level, depending on the country where you are coming from. In Ghana, our tertiary level, we tend to use the national. You understand? We use the national. And then the regional, the secondary, we rather use regional. And then the primary, we use the districts. But in other countries, the primary level, they are calling it district, some say sub-district, or the sub-county. As I said, depends on where you find yourself. So this is the levels by which the health system or health everywhere, especially in the African sub-region, this is how it is organized. You have the tertiary, the secondary, the primary. So the tertiary is the national or the headquarters level. And then you have the secondary, which is the regional, the provincial or county. So when you go to the hospital base, the tertiary could be the teaching hospitals. The central level is the teaching hospitals. And the secondary is where you have the regional hospitals. And then the primary level, you have the district hospital. And it goes down, you have, and below the district, you have the health centers. And then you also have the CHIP compound. And then we have basically the household or the families. So the families, the individuals, and the household, all of them, or whatever happens there, trickles up, it goes up, and it also informs our referral base, on basis on which we do our referral. The referral system is also based on that. For example, if a teaching hospital like Charitable or Confanochi, if you have just a common toothache, you can't just get up and walk there. You should have gone to maybe a polyclinic or somewhere for a referral before you can get there. And then you should note that each level has standards. Each of the levels that we talked about, they have standards and norms that define the service delivery and the health facilities. So each level, the services that they are supposed to deliver is different. You don't have the same services being delivered across the levels. For example, if you go to Charitable, the services that they provide, you don't expect that you get some at your district level, your health center, or in a CHIP compound. And in the same way, because you have different standards and then the service that you provide, the same way the professionals at each of these levels also vary. You don't expect that you go to, it's now that some of the health centers have medical officers because they are looking at the load, the workload in those facilities. Other than that, the health center, you rather have a physician assistant manning it. You may not have a medical officer, or you have a specialist person there. So that is it. You have the standard and the norms. And this standard and norms define the services that is being delivered at each level. And then they also tells the professionals that should be there. Then we'll look at the context, the economic context. And the economic context, those of us in sub-Saharan Africa, you should have at the back of your mind that we have high poverty levels. To start with, whatever we do, we are constrained by resources, high poverty levels. So the high poverty levels also defines the services available, the care, and even at the way we assess the services. If I cannot afford a certain kind of services, I will not even go there. I would rather resort to the herbal preparation or go to a prayer camp because I cannot afford the money that is being charged there. So we have these high poverty levels. And some of them, at times, when you treat them, That is why from time to time you realize that people even run away from hospital. They went on admission. When they can't pay, so they have to leave, or somebody will have to come and pay on their behalf. There's high poverty levels. Because there's high poverty levels, even the facilities that we have are not even up to standard. We can't even well-resource the facilities. And then there's also low investment in health at all levels. We don't have money, so we are not interested in health. It runs through from the government to the one that assessing the services, the client. We don't have money. It's now that because of the COVID, we know the importance of health. Other than that, we have low investment in health. If you have a headache, you just go to the chemical seller and buy some painkiller, and that is it. Even though the headache could be a symptom of a serious disease, until the disease, the illness or the disease becomes serious, you don't even bother. Some can just depend on anointing oil. Let me go for prayer. They give you anointing oil, you smear it on your body, and then your psychic tells you that you are well. We are not interested. We don't even think about going for checkup. We preach it, but how many of us genuinely, beginning of every year or middle of every year, you go to the hospital and say you want a total checkup on yourself? We are not interested in health. And then there's also unsustained and fluctuating donor support. In Africa, we depend so much on donors, and then the donor supports are not coming. You can't sustain it because some programs that the donors will introduce, they are all time-bound and yes, it's based on time frame. They are time-bound. Maybe we are malaria control. We are supporting you for 5 years. So after the 5 years, what happens to the program? And as a country, are we able to carry on when the donors have pulled out? And now, we say we are middle-income country. So the donors, most of them have pulled out. The donor support are not coming. That is why we are all hard up now, because a few programs now, there is a few programs that donors are supporting. And even if the one that they want to give money for, they will tell you what you should use the money for. Even that may not be your priority as a nation. But that is what the donors will say, that I've given you money for that. There was a time that I think that was the year 2000, we started developing a policy, gender policy for the health sector. People were sent outside for training. So when they came, they started the development. But at a point, I think it was being sponsored by the British government. At a point, they stopped, or their period expired. Then the program stalled because we didn't have money, and it wasn't even the interest of the ministry as a whole. The British government wanted us to inculcate gender issues into the health practices. But there was no money, there was no budget allocation, and that was it. Then later, I think UNICEF also came in and said I will support, is it maternal and child health, nutrition and gender. Then the Ghana Health Service said, oh, okay, we have this gender policy that for years we haven't been able to finalize. So if you are talking about maternal health, gender and nutrition, there's also gender. And then our policy covers this area. So let us use your money to develop the policy. And so Ghana Health Service and the consultant went ahead, did it. And when they finished, UNICEF said, no, the consultant, that wasn't the mandate I gave you. So I'm not going to pay you. I don't know whether they have settled it. So this is what we are talking about, the fluctuating donor support. If you have the money, they said we are supporting you for 5 years. After the 5 years, what happens? And there's also uneven progress in health. Uneven progress in health. And then growing gaps. The uneven progress in health. The rich, they can get what they need. You realize that You can, if you have money, you can go to South Africa. The politicians, they are flying out every now and then for care, simple care. So there's this, the inequality gap is widening. Even within Ghana, those who can afford, you go to SNIT and all those places. Even in the government sector, giving medication, there are certain medicines when they give it to you, in no time you are well, but they are very expensive. So they will, before they will prescribe, they will look at you before they will prescribe. So that is it, uneven progress in health. And then there's also growing gaps. Those who can afford their gym, they go to the gym and all that, exercising. But if you can't afford, what do? You remain the way you are. And there's also focus on few program areas, with others ignored, mixed. And there's also gap in health services. The gap in health services is increasing. There's focus on few program areas, like malaria control, TB control, maternal and child health. And then, but health entails a lot. There's so many programs, there's so many issues in health. But you realize that because of the donors fund, money coming from donors, we have focus on few of these programs, because the donors tell us what we should use their money for. And at the end, we turn out to ignore others, and other areas also get missed, like the care of the aged. Who even mentioned them? Everything is about maternal and child health. But those, the elderly, what happens to them? So these are the things that we are talking about. And there's also gaps in the health service. The gaps in health service is also increasing. And like I said, you realize that everything is donor-driven. The priorities is based on the funds that we are getting. And there's burden on healthcare financing. The burden in other countries, you have the user fee. Even in Ghana, that we say we have insurance, health insurance. Indirectly, the user fee is there, because some of the specialized care you need to pay. They are not on the health insurance list. So what happens if the care that you need, the cost is not covered by health insurance? Then what do? You have to pay. And how many people can afford? So that is it. There's burden on healthcare financing, especially when you are using the user fee. There's also persistent inequalities in access, use and financing of services. So in assessing healthcare, and the access, you have the financial access and then geographical access. The financial access is your ability to pay, ability to afford healthcare, because the rich can afford. So they will go to all extent to get the needed care. But those who cannot afford, what can you do? You have to rely on the system that is not effective. And then we are talking about geographical, even siting of hospitals and other things. There are so many districts, rural areas, hard to reach areas in Ghana, that we don't have hospitals there. And even the few that have hospitals, you realize that people don't even accept postings to all these areas. And this is leading to that inequality, because when you are posted to such area, how do you get education good education for your children? At times, there's also no potable water. Accessibility by road is also a problem. So there's always this inequalities, and it's persisting. And then that is it. It's about financing. You don't have money, so what do? And then the illiterate, you have a lot of poverty. You have a lot of illiterates and other disadvantaged groups still not accessing services. The illiterate, the poor are still not accessing, because the poor cannot afford some of the services. And then the illiterate, at times, the system even intimidates them. The hospital setup intimidates them. They cannot read. And at times, with the providers, a little question that somebody asks you even agitates you. Explaining procedures to them becomes a problem. So what do? They will not even come. They will not come. They will go to where they feel more accepted. that if it's a pregnant woman, they will prefer going to the TBAs, the traditional birth attendants, or they will go to the pastors, those religious camp and all that. And that also has a different effect on their health. So you realize that the poor, the illiterate, they are disadvantaged. The other disadvantage, they don't access the services because they cannot afford. They don't even understand. And the system becomes intimidating to them. And there's also inappropriate application of technology. New technologies are coming out every now and then. Do we have the qualified people to even man it? Do we apply the technology appropriately? These are some of the things that affect us in sub-Saharan area based on the economic context. And then you also have the socio-cultural and then political context. There's strong cultural norms and values that influence our behavior, our health-seeking behavior. Our cultural norms, our cultural backgrounds, and then the values that we hold in society influence our behavior, the way we assess health, the way we even see health. Our cultural behavior, some of the taboos and other things affect our behavior. In some places, they will tell you that there's a taboo for a pregnant woman to even eat egg. Remember, egg is a rich source of protein. And as a pregnant woman, you need a lot of protein. But in your society, eating egg is a taboo because they are claimed that when you eat the egg, in future, your child will become a thief. Who wants the child to be a thief? You understand? And then when you go to some cultures in a northern part of Ghana, if you have even some cultures in the southern part, if you have a difficult labor, a woman, then you go into labor and you have a difficult labor, then it means that you've been unfaithful to your husband. So they will send you to the oracle. You have to confess. If you don't confess, you will die. Instead of sending you to the hospital early, or if there's a need to do a CS to save your life, this is it. You've been unfaithful. So you confess. You will lie down, and if you don't confess and you will die, nobody will even mind you. So these are some of our cultural norms. Some will tell you that, oh, I'm a royal, so a knife should not touch me. So if you have a condition that is through surgery that you'll be saved, because you are from the royal family, and the knife shouldn't touch you, you refuse. You may refuse the surgery, and at the end, it will have effect on you. So our strong cultural norms also has a lot of influence on us, on our behavior. The way we seek health, the way we look at health, it affects us. At times, certain kind of disease, they will tell you that somebody has, is it juju you, in quotes? Somebody has placed a curse on you. That is why you are going through that. So because of that, you go from one herbal fetish priest, one religious camp, and whatever you go. At the time you get to the hospital, it may be too late. So that is it. And then there's a resilient yet ineffective traditional health system. Our traditional health system is resilient, but yet it's ineffective. You look at our herbal preparation. I'm not saying that the herbal preparations are not good. Some are very, very potent, but there's a lot of them that are not effective, and they are also dangerous. But they are thriving. They are coming out strongly. Who even tests for their side effects and other things? Even look at the way we drink it. You pour it into a whole cup. You understand? So that is it. Our traditional health system is resilient but very ineffective. But as Africans, we believe in them. We believe in our traditional system of health. So that is it. Then you have poorly operationalized social dimensions of health. Social dimension of health is something that we don't even look at. If you go to the hospital, you present with certain condition. Do we go back and find out what do you do? What work do you do? What pertains in your home? So, or you come to the hospital today, you are having high blood pressure. They give you medication, and anytime you come, it is there. Do we go back to find out what is existing in your community or in your house? What is the condition in your house? What is making your BP not coming down? That is it, our social dimension of work. At times, our relationships also have effects on our health. The work we do have effect on our health. Our social life all have effect on our life, but they are poorly operationalized. We don't even consider them as part of the health system as Africans. Then you even look at political and civil strife from protracted war or conflict. In Africa, where every now and then there's this conflict, wars, civil wars all over. And all these things affect the health system. Because if there's a civil war in a certain part of your country, and then you are a nurse, you complete and we post you there, who will want to go and die? You will not want to go there because your life will be in danger. And then at times you realize even the warlords, they attack hospitals and other things. They go and destroy everything. They don't care. They don't even care whether people will suffer. And the people that they are killing, even they themselves, if they get hurt, where would they send them to? So the political context is also key in Africa. Because of that instability is there, and it also adds on to the inefficiency of the health system. Then there's also weak political will to implement policies. Our government, our decision makers, health is not their interest. So they don't have too much interest in it. They have the weak will to implement policies and commitments. They are not readily. Until recently, that now, especially post nurses training and other things, it's now becoming a political issue. That every person, every presidential person, nursing training, I will do this, I will do this. Other than that, they have that weak political will. So we realize that the money is coming to the health sector. It's dwindling. We don't have enough money coming to the health sector because the government, that is not where their interest is. And then you have poor stewardship. Yes, the poor stewardship. Things that are entrusted in our hands as providers, how do we take care of them? We don't own them as our own. At times, we even steal them, pilfering. You understand? It's not mine. So you are not bothered. So that is why we don't even have that maintenance culture, because we don't see it. Stewardship is about ownership. We don't see it as our own. There's that poor stewardship. And that is it. That is why, for example, Kolebu, at a point in time, the CEO, even though they didn't have oxygen plant, they were able to buy a V8 for the CEO to sit in. If you have the hospital in mind, you buy a plant. You buy that oxygen plant for them. You will not go and buy it for a V8 for one person to sit in. Then there's also new challenges to health and then the health system. New challenging, new and re-emerging conditions and threats. New challenges. Even now, the COVID is a new challenge to the health system. It's a disease we haven't seen before. We don't know anything about. And then it just started in China. We thought it was China issue. But now, it is with us. And it's posing a lot of challenges to us because we have not seen some before. There's nothing in place to manage it. So that is it. New challenges are coming, new diseases are coming, and they all present a threat to our system. And there's also re-emerging conditions. Some of the health conditions that we think we have eradicated, like TB. Now TB has come. And now they say drug resistant. They are even resisting the bacteria is resisting the existing treatment. You understand? So all these things is affecting we, the Africans. And that is what we see. And our new behaviors also is contributing to new conditions coming. Now we are, is it copying? We are also becoming westernized. The food that we eat, our behavior, and all this presents new threats, health threats to us. You sit in everybody wants to sit in an air-conditioned car. Then even look at the way we build our houses now. We build, and then we are using these glazing doors. We make provision for window. But at the end, we cover one side and leave one side. We don't have enough air. So if you don't have air conditioning in your room, what happens? And some has air conditioning they have air conditioning in their room. When there's light off, what do? You understand? So these are the re-emerging conditions, and it's based on the new behaviors that we are inculcating. And it's also presenting new threats to the health system. And there's also changing behavior. And so it ties in what I just said. Changing behavior. We are changing our lifestyle. We are even changing the food that we eat and all that. And it's also leading to new health risks for us. Diabetes, hypertension, they are on the increase. We are changing the way we eat. Our local foods, if you come in and eating contomere without any oil on it, you will see me to be some way. But if you come in and eating pizza, fried rice, then it's yes, that is it. So we are changing the behaviors. Now, we sit in cars a lot. We don't walk again. And all these things present new health risks to us. There's also rising expectations and growing dissatisfaction. The community, the clients, the population expect so much from the health sector. And then, but they are not getting it. So there's also that the dissatisfaction is also growing. People, they are becoming dissatisfied with the health professionals. And the health professionals themselves are also becoming dissatisfied, because if you expect me to give you the best care, then I also expect that there is also improvement in my remuneration, which is not coming. Even the conditions under which they work. Some time ago, there were no gloves. Even if you want to examine a patient, they will tell you that improvise. Improvise means you should wear polythene bags on your hand and then go and do bed bath, or you are doing wound dressing, which you also stand to infect yourself. You understand? Meanwhile, the population or the client expects that you give off your best. Every now and then, people are lambasting the health professionals. But they are also becoming dissatisfied, because the things that they need to work with are also not available. Things that will make their work easy, improve on the quality of care that they provide, are also not available. And that is what we find ourselves as Africans. There's also globalization. People now, you can just Google and you get treatment for your care. As to whether that is the actual treatment or not, that is it. And there's also better information flow. And because there's better information flow, people also they are aware of their rights. You understand? As I said, you can just Google and you get information of certain kind of diseases. But you should also know that some diseases present at the same signs and symptoms, but there could be just one cardinal sign that would differentiate them. But you may not get that from the Google, and you implement whatever you've seen, and it can have effects on you. There's also better information flow. So everybody wants to be, I don't know, is it a mouthpiece, or you want to talk, you want to get information. This COVID, people were saying that, they should let us see those who have recovered or those in critical condition and all that. Meanwhile, they also have the right to privacy. They also have the right to privacy. And within the sector, privacy is also very key. So this is it. And because people are also getting aware of their rights and have better information flow, if you do things anyhow, you do things anyhow when you're taking care of somebody, then they can also see you. They can see you. So now you should know that the system, the health sector, can be sued. It can sue and can also be sued. And there's mismatch between expectation and performance. It's the same thing like the rising expectation. Mismatch between expectation and performance. The society expects so much from the health sector, but the health sector also don't have what it takes to give the best of care, to perform well. So you expect them to perform, but the things that they need to improve on their performance are also not available. And the fourth one is the legislative context. The legislative context, we are looking at laws. We should know that health, there are so many laws, declarations, and commitments on health. And some are global, some are international, and some are also regional, and some are national. So everything that we do as a health sector in Ghana, we don't do it in isolation. There are international or global laws that govern. And then the regional is not talking about regions like Eastern region, Greater Accra region. We are taking the globe. It can be the African region, it can be the European region, the Asian region, or the Americas. And even within, let's say we take Africa. Within Africa, we have the West Africa region. We have the South Africa, East Africa. So on health side, that is how the WHO divides or classify the regions. It's not based on a region like Eastern region and other things. So when we come to West Africa, the West Africa sub-region, we have laws that governs the practice on health. And then we take national. The national is the country base. The national, like in Ghana. And within Ghana, we also have national laws on health. So that is it. We have the global or international, so many declarations, there's so many laws. And then we also have the regional and then the national law. And then the international law, we should also bear in mind that our countries have signed, they have agreed to the implementation of some of the international laws. So it binds the way the health sector is supposed to operate. And the international law, even now what is happening, we have a law that we call the International Health Regulation. And that International Health Regulation binds every member of WHO, every country that is part of WHO, to do certain things. And then the things that you are doing, you have to make sure that you are preventing international spread of disease or risk. You understand? So that is why some of the issues, you realize that some government cannot readily come out boldly to take or do anything otherwise because they are being governed by these international laws that are in place, like law on the health for all. Health for all, primary health care, they are all international and then regional laws. And these are some of the declarations. These are some of the international declarations. We have the Millennium Development Goal, and the Millennium Development Goal, there's some goals that are related to health. Now we are having Sustainable Development Goals. So there are specific goals that has to do with health. And all these things affect the way we practice. We have one that talks about the effectiveness of aid, the money, the donor funds that we receive, how effective are they? What can you do with that? And all these things are there. Then you have under the regional commitment, the West African sub-region, and then the African region. These are some of the declarations. There was one on primary health care. So, and then the place that declaration took place. Primary health care, you know the concept of primary health care, getting health to the doorsteps of people. And that's brought in the CHIP compound, community-based health planning services. That is why now we have CHIP compound in certain remote areas, so that at the doorstep of the community, if there's any minor ailment, you go to the CHIP compound and at least you get some first aid before, if there's the need to be moved up, before you go up. And then that is it. And you have one that is talking about health financing and then health system strengthening, and then the laboratory, strengthening of laboratory. If your laboratory system is weak, you will not be able to confirm a diagnosis. So there's the need to strengthen. At a point, there was the need to strengthen the laboratory system, and that declaration took place in Maputo. So these are some of the regional declarations. You have the one that talks about social determinants of health. Socially, what determines health? There are so many determinants of health. The social one, you can have occupation. Occupation is one, sex, education. They are all part of the social determinant of health. So at a point in time, there was the need to look at socially what determines health, because you can't just center everything on medicine or medically or disease-based. Some of the diseases are as a result of our social life, our social status, or where we live and what we do, all determine some of the diseases that we have. And then you also have the research, health research. This declaration was passed in Algeria. There was the need to have research based in health. You need to do a lot of research in health to be able to come out with patterns and other things. There are so many data that we collect within health. What do? You analyze them, and based on that, the findings, you are able to make appropriate decisions on the care of people. And then the fifth one is the main actors. The main actors in the arena of health. The main actors are the stakeholders. We have the core stakeholders, the partners. That is those who fund, who give money for health activities, to implement health activities. And then you have the providers, the healthcare providers. And then you have the clients, they purchase the health. And you have the people in the government or the decision makers who also implement healthcare. So you have the core partners, you have the funders, the providers, and then you have the government. You cannot operate without funds from the government as a sector. And in Ghana, the government give money. Beginning of every year, government is supposed to give money for every sector for the implementation of their actions. And then you will get some from the government. So in Ghana, there are three ways that we find money. We find our health system. The one from the government of Ghana, and then you have the internally generated funds. When you go to the hospital, certain services you have to pay. So they are the internally generated fund. And then the money that we also get from the donors. And that is what you have, the NGOs. The NGOs could be the private. There are some NGOs who also give money to fund health activities. Some are not for profit, especially the faith-based, the church-based NGOs. They are not for profit. They just give money for the activities to improve upon the health status of the people living in Ghana. And then you also have some that are for profit, especially you realize that some NGOs, they have even gone ahead to open hospitals. The faith-based one, that is what we call the CHAC, is Christian Health Association of Ghana. And then they have come, some a Christian or some faith-based, they have come together to form that association. And some they provide health services. They have hospitals. You have the Catholic hospitals, the SDA, the Presby, so many of them. And you have the Muslim. The Muslim, they also have their hospitals. And they are part of the private, not-for-profit, but they are not part of the CHAC. And then they are also private, but though they are providing health services, they are also in to make profit. Like when you go to the SNIT hospital is not a government institution, a government hospital. They are in to make profit. Nyaho, they are all there, so many of them. They are in to make profit, but they are also in making profit. They are also providing health services. And these are the main actors in the arena of care. Then you have the civil society organizations. Civil society organizations, there are so many associations that they also have some role to play when it comes to health. like the Rotary and other people, they are all part of it. At times, even in your community, you organize cleaning and all that. They are all part of the health, civil society organizations. And then somehow you also provide health activities. Then you have the development partners, the donors. And then the donors, they internationally, they give us money. You have the international one, you have the bilateral, and then you also have different foundations, like the Bill Gates Foundation. They also give money to sponsor health activities in so many countries, and there are so many of them. And even some are local. Within local, you at times the Peace FM man, despite, they all give money. They are all part of the development partners, and they are all part of the donors. And of course, you have the media. We can't work without the media. The media, they are very key. They are a major stakeholder when it comes to health. If you want any program, people to understand any program, you need the media to do that. Health education talks, you need the media to do that. So the media is also part of the actors when it comes to health. So that is it for the health system. And then we'll move on, and then we'll look at some of the components. Every health system has a component. And then with this, we'll look at just two frameworks that has tell us what a health system, the component that should be in. And the first one is the Roma Framework, or the Roma's theory. And they have come out with 5 components. So to the framework, this framework, every health system should have these 5 components. You have what you call the production of resources, organization of programs, economic support, management methods, and then delivery of service. So for the production of resources, the framework, Roma's framework, is talking about, you look at the human resources, and then the facility and infrastructure, then commodities and body of knowledge. So to them, the production of resources, you are talking about persons capable of providing health services. So every health system, there should be human resource, and the human resource should be people that have the capacity, they are capable to provide the health service. They should have certain kind of skills. You can't just take people from the street and you send them to the hospital to provide care. They should have been trained. They should have certain skills before they can operate. That is it. And there are so many resources, human resources, within the health sector. They have the doctors, you have physiotherapists, you have the clinical psychologists, you have the nurses, and even within nursing, there are so many categories of nursing there. And before they can practice, you should give them the skills to make them capable. You should give them the skills. It's not everybody that you can take to the ward to go and give nursing care. That person should be capable of providing the health services based on certain skills or based on what goes into the person's training. And not just that, that person should have gone through the training over a certain kind of years or period before you can. Other than that, we can say that we can just take anybody on the street. Then there will not be the need for people to even go to school for 3 years to study or to be trained to become nurses. Before you can be that, you should be capable of providing the health services. And then there should also be facilities. If you have the human resource, there should be facilities or infrastructure where they can work. The providers can do their work. So that is why we have the hospitals. We have the lab centers. If you have lab people, there should be a laboratory. So you are looking at the facilities. There should be facilities in which the providers or the capable persons can work to provide their services. And then you should also have commodities. Now you have the human resource, you have the infrastructure. There should be commodities or supplies. And commodities, we are looking at drugs and non-drugs. The drugs, because we are taking care of people, it has to do with diseases. If there's the need to provide certain medication, drugs should be readily available. And then the non-drugs, the consumables, the cottons and other things, syringes, all will have to be available before the human resource, the capable human resource, can provide the services needed. Then there should also be a body of knowledge applied in the system for various curative or preventive purposes. You have the human resource. We talked about the fact that they should be capable. So there's a need to train them. And in training them, you need appropriate knowledge. You need a body of knowledge. You can't just train nurses and then you are just training them. There should be a specific knowledge that you inculcate in them. And that knowledge should be based on, it could be either based on curative or preventive knowledge. If it's curative, those who work in the hospital setup, they are doing providing curative services. So the knowledge you give to them, it should be tailored towards that. The general nurses, midwives, they are all curative, intensive care nurses, accident and emergency nurses, they are all curative nurses. So you give them the appropriate knowledge to them for them to be able to provide the needed care. And then you have the preventive. For preventive, you have the community health, you have the public health nurses there. You understand? You have the health promoters, health education, they are all there. And then yes, the knowledge should be such that they give a preventive care. Before some people even, the disease occur, before you go to the curative, they would have given you things that should prevent you from getting sick. So that is it. You should, when you talk about production of resources, we are talking about human resource, availability of capable human resource. Then facilities and infrastructure should be available. Then commodity, and obviously the body of knowledge. Then we'll look at the organization of program. And it is the systematic arrangement of various resources with designated responsibilities. The arrangement of various resources, the human resource, material, financial. How do you arrange them? How do you manage them? And then who should be in charge of what? So with designated responsibilities and special channels of communication. So if it's human resources, they should have specific duties. They should have specific responsibilities, lines of authority, channel of communication. Who should be responsible for what? If something goes wrong, whom do we take charge? Who should answer for that? Who are those in charge? The lines of authority. Who are, if you take the nursing, what is their line of authority? When you go to a specific, like, let's say maybe Charitable medical department, who's the line of authority? How is it like? Who is in charge? Do you have is it the chief or the DDNS, the Deputy Director of Nursing Services, the Principal Nursing Officer, the Senior Nursing Officer, the Nursing Officer, and it runs through that. So that's arrangement of resources. And if it's material resources, who are those to be in charge? Is it the procurement officers or health service administrators? All these things should be in place. When you are talking of they all should be part of the component of a health system. And then all these things will gear towards attaining a certain kind of objective. And that objective is to take care of the people living in Ghana or the country wherever you find yourself. And then this organization of program may be done. It could be by the ministry. So this one is also depending on where you are finding yourself, which country you are coming from. It could be the Ministry of Health. It could be other government agencies. I mentioned the federal in Zambia. They have the ministry, and then I think it's the Works and Housing or something. So they have other agencies. And then it could be voluntary bodies and enterprises, and also private proprietary market. In some places, you realize that they even loan some part of health provision to other private people, so that wherever you access, you will pay, but they are all geared towards efficiency in the system. And then you have the economic support. And the economic support is talking about funds getting money for healthcare delivery. And then you have the general taxation. In Ghana, we have the general taxation that even those of us working, at the end of every month, you pay tax, the income tax that we pay, the VAT that if you go and buy something is on it. They are all part of it. The Ghana Revenue Agency Authority, the money that they collect, they are all part of the general taxation. And then you also have various insurance. Through insurance, we also find activities, and these are some of the insurance. You have the social insurance, you have the classical, and you have the mutual health insurance. And then the classical one, like what is being done, the government is deducting. Those working, you pay, they deduct money from you. And then that money that they deduct is supposed to serve the needs of everybody. Those who can afford, when they go to the hospital, then they have to get the needed services. And then the mutual health is you contribute. If you don't contribute, you are not part of it. It's almost the same as the voluntary insurance. But the mutual have like maybe this community can come together and then you contribute, so that whoever, if one person of the group is not well, then the group will take care of. For example, what is happening in the, let me see, some of these telecommunication agencies like Tigo and other things, now they are also operating somehow some of this insurance. That every this thing that you buy, credit that you buy, they deduct something. So in case you go to the hospital and you're admitted, they have some amount of money that they will give you. Then you have the private voluntary, and the private voluntary too, if you are not a contributor, you also don't enjoy. And some of organizations, they have this private one for their members. They have it and they deduct money from their salary and put down, so that in case of emergency, you get money. And all these things will go in taking care of, or will help the health sector to get money to fund their activities. And then you have charitable donations, and that could be foreign, and it could also be local. Some organization fundings, international one, they also donate for certain programs. You have the Mary Stokes, they are talking about family planning and maternal health. You have the Bill Gates for malaria control and all that. So there are so many of them that gives money. Charitable organization, they give a lot of money. Then you have individuals and family. Locally, we have individuals that also contribute. At times you go to some of the hospitals, and then you realize that some family have adopted the whole wall. They refurbish the ward and give money for activities within the ward. And that is it. Or once in a while you see that an individual can say that I've given so much for people especially Kolibu, the children ward. You are giving so much. All Mothers Day, who cannot pay, I have paid for them for their admission or whatever fee. And so that is the way that we fund the health facilities. And some individuals can say that when you are dying, you have bequeathed this amount, you have this amount in your bank, and then you bequeath it to the system for the care of people, those who cannot afford. So that is it. And then you have what you call management arrangement. And this is how it is. The planning, we are talking about planning, administration, regulation, and legislation. The health sector or the health system, every health system, there's the need for effective planning. Every activities that you do, you need to plan. Even as nurses, When you are giving care to a patient, you need to plan. That is why you need to draw your care plan. And in the care plan, you detail all the activities that you will do for that particular client or patient. In the same way, beginning of every year, the health sector is supposed to come out with a plan, a composite plan. And based on that, the plan also goes with budget. And then based on that, they will send a budget with a plan to Parliament. And it's based on that the government will give them money to fund or to run the activities for the year. And then you have the administration. Administration, we are talking about the levels of responsibilities, the day-to-day running of the health sector. Who is in charge of the health sector? Of course, it could be the minister. Who are those that the minister work with? The various agencies, the various hospitals. When you go to the teaching hospital, how is it run? So that is the administration. And then you have regulations. The regulations, the policies that also governs activities at the health sector. And then the legislation, the laws. Do we have specific laws for public health? Do you have laws for health? The laws, what does the law say? If you go and do things anyhow, when you go, I don't know whether they are still there. Some time ago, the Ghana itself developed what you call patient charter. And the patient charter is a kind of law. It is there. It details what the patient stands to get from the health provider or from the facilities. And then there are also things that borders on the way you deliver care. Disciplinary procedures, they are all regulations that are in the system. And then all these things is geared toward, or the objective of all these things is to give the needed care, improve on the care that we give to clients. And the last one for the Roma Framework is the delivery of service. The delivery of service, it's also, according to them, it is also like the levels of care. You have the primary care, and the primary care to them is talking about the prevention and treatment. So at the primary level, the CHIP compound, the district level, or the health center level, the sort of care that you give. If at the CHIP compound or in your home, you are talking about prevention. So before you even come to the hospital, there should be things in place to prevent you from getting sick. So the community health workers comes in, the public health workers comes in, disease control, they all come in. And then you go to the treatment. The treatment level, if things doesn't work, you get sick, you get to the hospitals. What kind of treatment should be given to you? So that is it. At the primary level, the CHIP compound, what sort of treatment are they, or care are they supposed to provide? What sort of services are they supposed to provide? And then you have the secondary level, and then you have the tertiary. Like I said, in Ghana, the secondary could be the original level. At the secondary level of care, when you go to the regional hospitals, what are you supposed to see? What do you expect? What kind of services are they supposed to provide? What kind of health professionals are you supposed to see? The specialized care that they give, all that, you look at that. And then the tertiary. The tertiary is the teaching hospital level. At the teaching hospital, what are the care that they are supposed to give? What kind of specialized staff to be there? What kind of specialized care that needs to be given at the teaching hospital? And then you have what we call care of special disorders and population. So aside the primary care, the secondary and tertiary, we have to make a specific emphasis on special disorders and the special population. Who are the special population? Children under 5, they are special population. The elderly, they are special population. The disabled, they are all special population. Those who have is a mental challenge, they are all, or learning disorders, they are all part of the special population. So there should be a special care for them. And special disorders could be those communicable diseases. that, like malaria, TB, and now the COVID is also part of it. It's part of the special disorder. Even the disabled, the different type of disabledness, they are all part of it. Those who cannot speak, the deaf and dumb, they say they are speech impaired. The speech impaired, the hearing impaired, they are all part of the special population. And then there's also need for something in for their care, the special care for all these people. So that is how the framework define the delivery of, or look at the delivery of service. So it should be based on these levels. And this is how, dramatically, this is how the framework looks like. And then we'll move to the next one. The next one is about the WHO. The World Health Organization also has a framework for the health system, a component of health system. And their components, at times, in some books, they will tell you that the building blocks of health system. And this is, dramatically, this is how it looks like. You have delivery of service, you have a health workforce, you have health information, then you have medical products, vaccine and technology, health financing, and then leadership and governance. And then you realize that at the left side, you have the building blocks, and then the right side, you have the goals and the outcomes. And in between, you have something there. So the first three, service delivery, health workforce, health information, when all is working well, then they are tailored towards access. They are to improve access and coverage. And then in that, you look at the improved health levels and equity. If all service delivery, everything is working properly, efficiently, then there's improve in the health of people and in the level of care that they give. And then it also, when there's improvement in healthcare, it presupposes that people will have, it doesn't matter who you are, you get the needed care. So there's fairness and equity in the system. Then it's also, they talked about responsiveness to legitimate needs. So if all the system is working properly, the health information is available, health workforce, that is the human resource, they are all available, then the system is responsive to the needs of the population or the client, because wherever you find yourself, you get the necessary care that you need. And then the last three, the medical products, they are also talking about quality. They are in to ensure quality. If there's availability of vaccine, there's availability of drugs, and then appropriate technology, the lab is working effectively, then you know that there's improvement in care. And also the issue of safety also comes in. Financing, health financing, if you have money for everything, the system is working, the equipment that we need, they are all available. They all stand to improve in the quality of healthcare. The leadership, you have people, good people in place who see the system as their own, good stewards. And then they make sure that programs that they bring are sustainable. It leads to improvement. It leads to safety. And that there will be social and financial protection. Financial protection, we will not waste money needlessly. And social protection, people will be secure, people will be saved. And all these things will lead to improved efficiency. So that is what the WHO component is talking about. While the Roma Framework has 5 components, WHO has 6 components. So these are the components. So we'll go a little bit into details. The first one is service delivery. You realize that the Roma Framework, the last component is delivery of service. So you don't need to confuse yourself with that. While the WHO component, the first one is service delivery. So you take note and you don't confuse yourself with that. And WHO is saying that the service delivery should include delivery of effective safe, quality, personal and non-personal health intervention. So they are looking at quality, delivery of service. If you are, the services, the healthcare that you are giving, you make sure that it is safe. And then it's also at a level of setting, the quality should also be there. Quality, personal, and personal health interventions. So the things that you are using directly on patients, the interventions that you are directly on patients, the quality should be key. For example, for this COVID, before you take care of a patient, you should wear your PPEs, the personal protective equipment. And even in wearing it, there's a way to go about it. So you have to cover yourself well so that you don't infect the person, and the person does also not infect you. So every intervention, there should be some kind of quality. And then the service that you are giving, it should be to those that need them. So you look at the priority of people, the need of people, to those that need them. When and where. So it is also time-bound. Those that need them, when and where. For example, some vaccines, it has to be, when you are managing it, even transporting it. For example, when we have a national immunization day, and then the community health nurses are sending the vaccines to the villages, there's also a time bound. So beyond that time, you realize that the potency of the vaccine could be compromised. So that is it. The intervention that you are giving, you make sure that it's going to serve the needs of those who need them, when they need them, and where it is needed. And then there should be minimum waste of resources. You understand? So if there will be any waste, it should be minimum. We don't expect that you waste resources. But if there's there is, then the waste should be very minimal, because you are serving those who need them. So it's not like you don't need them. Yeah, I don't need them. So why are you giving me? They need it, so you are sending it. And then it's going to the time when they need it. So it's not something that is going to expire for you to throw away. And then where needed, the place that they need the service or the intervention most. So that is it, the service delivery. That is how WHO sees it. And then it's also involved demand for care. So if there's quality, the care that you're giving or your services has a good quality, then there will be demand for care. You understand? For example, people don't go to the hospital because when you go cry, what can they do? You will still not get the cure or treatment for your problem will still be there. So why should we go there? But if there's quality, and I know that anytime I come, the care that is giving me or what I need is what I get, then there will be demand. We always want to come. There will be demand for your care. And then there should also be service provision models and integrated packages. There are so many models for service provision. Some will say that comprehensive, for example, you can have comprehensive nursing and all that, individualized nursing. So there should be an appropriate service delivery model put in place, and then there will be integrated packages so that you don't run programs vertically. Integrated packages. You are giving children immunization. You are giving 5 in 1. You can give one immunization, and it takes care of about 5 or 6 diseases. So that is the integrated packages. And then leadership. We are looking at leadership and management, effective leadership, and then management of the system, and also infrastructure and logistics. So maintenance culture is also key here. It's not always that you have to sit there and say that there's no money. What can you do within the constraint that you have? What can you do to avoid or minimize waste? And then the second one is the health workforce. Health workforce. You realize that the Roma Framework also has is a human resource. And then WHO is talking about health workforce. And this refers to human resource that is responsive, fair, and efficient in order to achieve the best health outcome possible. The human resource to be responsive. Roma's framework talks about capable persons. And then WHO is saying that a responsive human resource. The responsive human resource because they should have the needed training and then the needed skills to be able to respond to the health needs of the population. And then it should be fair. If you are training them, you don't discriminate. Even starting from the training, you don't discriminate. And then when you finish training them, even distribution should be fair. You have to base on the needs of the various hospitals, or for example in Ghana, if you are making distribution, it should be based on the needs of the regions, so that at the end, there will be equitable distribution, and then efficient in order to achieve the best health. So you are looking at the responsiveness. The responsiveness training goes in, and then fairness is talking about is talking about equity. And then in all, if you have people that you have trained and you distribute them fairly, then they will be able to achieve the best health outcome possible, given available resources and then circumstances. So the limited resources within your means, if you distribute people fairly, you train them appropriately, they will be able to provide the needed care. And then you also look at the circumstances. For example, this COVID time, we realize that we need frontline people. We need people that have knowledge in emergency. We need people that have knowledge in intensive care and all that. We need public health nurses. We need clinical psychologists, those who will go out and give education. So you are looking at the circumstances, and then you are also looking at the available resources. And then you train and you distribute to ensure that you get the needed or the best outcome possible. Then it also includes the norms. There are also norms, standards that governs production of sufficient staff and ensure fair distribution. So that's what I was talking about. But there should be a standard. Every country, every health sector, you should have a standard. You don't just train professionals anyhow. And at the end, after training them, then you realize that you don't have what it takes to employ them. But if we have the standard norms available, then there will not be any, graduate unemployment or nurses that have finished and they are not being employed, because it's based on your needs. The norms at the end will tell you that when you take this hospital, at every particular point in time, you need nurses, you need this number of nurses to work. Or if you take a particular ward, based on the beds the bed available, and then the number of patients that are on the bed at a particular time, it can tell you that when you take, for example, the medical ward in Charitable, maybe you will need 10 or 4 nurses. And that will fit into your what we call your recruitment plan. So you have this standard available. If you have that, it tells you the staff that you need, and that goes into their training. If at the end you know how many nurses that you need for the year 2000, then from when they even enter into the selection into the nursing schools, it should tell you that in 4 years or 3 years that they will come about, these are the nurses that we need. And then straight away, they will be able to employ. And then even when they finish distribution, it should also be fair. You should not make other regions worse off. For example, in Ghana, now everybody wants to stay in Accra. Now they are doing postings for nurses. Those who were sent to OT region and other things, everybody wants to change and stay in Accra. So it makes the distribution not fair. And then you see a lot of political infiltration inside, protocol lists and all that. Everybody wants his or her child to stay in Accra. But if you are talking about fair distribution, it shouldn't be so. Wherever your services are needed, that is where you'll be posted to. And then it also ensures that they are also competent. Human resource competency is also key. And there's the need for what we call observatories, human resource for health observatories. The observatory is like a directorate. Yeah, it is like in the olden days that we used to have telephone directorates. So that is how the observatory is. So that directorate, when you go into that observatory, it tells you the number of specialized or that you have, or specialists that you have, where you can locate them. So when you take Greater Accra, it will tell you that you have this number of specialists. Doctors, we have this number of specialists, and then the areas of their specialization. When you take nurses, it will tell you that we have this number of nurses. These are the specialists, and these are the specialized areas. So anytime you need a specialist to perform certain acts, you go into that directorate, and it should inform you. And it's very essential to facilitate or help in the human resource management. Then the next one is health information system. Every system, health system, should have a health information, and it ensures the production. It ensures the production, analysis, dissemination, and use of reliable and timely information. So the information that you are collecting, the folders that when you go to the hospital, you fill, they should ensure the analysis. We have to analyze them. We have to analyze. You don't just collect them. People just don't write their names, their ages, where you stay, and all those for nothing. At the end, there should be the need to analyze. And when you analyze, you disseminate, because you come out with, it should help you to make a decision. Because in the analysis, it should tell a story. It should let you know the trends. Which age groups are being affected by this kind of disease? Especially the COVID. Initially, they said people beyond 40 and above, they are the risk factors. But later they realized that, the disease does not know any boundary. All age groups are being affected. So it's from this analysis, and based on that, you do an appropriate dissemination. And then there's also you use it reliably and timely. There should be a timely information on health determinants. So the collecting of data should let you know what are the health determinants. When you look at the folders, a certain condition is being presented among so many people. You can look at that. Is it affecting those who stay around wager? Or which group of employees? Is it among those that work in the query, or among teachers? So all these things will determine will let the social determinants comes out. The various, or maybe it's among various occupational grouping. Why is it? What is happening there? And that is it. And then health system performance. It also lets you to know the performance of the system. And then the status of health in the country as a whole, by decision makers and at all levels of the health system. So that is the reason why we need health information officers, disease control officers, information officers, because they will collect the data, they will have to analyze it, and then based on the data, the information, we'll be able to make an informed decision, timely decision on health status in the country. There should also be standard and integrated system and tools to ensure the linkages. So the data collection, the folders that I just mentioned, you should make sure that you have a standardized form. The folder is a tool for the data collection. And then there should be that linkage between the local, national, and regional level. The information that you use the folder to collect, it should be the same across board. So if you are at the chip compound, the whatever slot in the tool or in the folder should be the same as the one at the district hospital, the one at the regional, and then at the tertiary or the teaching hospital, for example, Kolibu. There should be that linkage, and then the tool should be a standardized one. So there shouldn't be any deviation from it. So that is the health information. Then you have medical products and technology. And this medical product ensures equitable access. It ensures access to essential medical products and technology that provides scientifically sound, quality, safe, efficacious, efficient, and cost-effective services. So the medical products is about the treatment. The drugs, if there's the need for X-ray and other things, any medical examination, we are talking about equitable access. So the access is also key. And the access, it could be the financial and then geographical. So if I go to Akaway, and then there's the need for me to go for certain medical examination, do they have what it takes to do the examination for me? So that is what they are talking about. And if it's about medicine, do you get the medicine that you need for that kind of diseases? So, and you are saying that all these things should be safe. It should be scientifically sound. So it shouldn't be anything that is outmoded. If it's a technology, if it's a scanning machine, it should be current. Yes, it should be current, and it should be something that is invoked. That should let you get the quality of care or the quality of resource that you need. And then it should be efficient and it should be cost effective. And the medical products include, you are looking at medicines, and then reagents. Reagent is what the lab people use for the lab investigation. So all these things should be available. And then the technology obviously includes the X-ray, the lab, the vaccines, the scan, and all those things. These are the technology, and all these things will have to also be available, readily available when you are talking of any efficient health system. And there's the need for, here too, you also need the norms and then the standard and policy options on production and technologies. So even in the drugs, there should be policies on how to produce the drugs. So that is why we don't just give drug anyhow. You have to pass through processes, the same way vaccine. Before any vaccine will come out, there are processes, the medical trials that they do. So that is what they are talking about. There should be policies on that, policy options on that. And even in buying them, there should also be some process, policies that should tell you how to procure the vaccines, even the technologies. If you bring an X-ray machine to the world, into Ghana, do you have to pay any tax and all that? And there's the need to monitor. And you also look out for the innovation. Now, we are having a lot of innovation in our herbal preparation. When it comes to this COVID, everybody says that they have medicine that will boost the immune system. And in boosting your immune system, it means that your system will be able to fight against the virus. So that is it. And then you also need patenting. New products that you have to patent. You give the right to whoever developed or has come out with it, so that people will not steal other people's work and present. And if there's something goes wrong with a particular product, you know who to hold responsible, and it's very key. So the next one is health financing. And the health financing include, according to WHO, includes raising adequate funds for health and then ensure that people can use the needed services. So the first and foremost is talking about health. They need to finance, they need to raise adequate funds. So before your system, in every health system, there should be a way of fundraising, raising funds or getting funds, because funding is very key. Funding is very key. If you don't have adequate funds, then it means that your provision of certain kind of services will suffer. So that is it. You need to there's a need to raise adequate funds to ensure that people can use the needed services. So you need certain kind of services. The issue of affordability comes in. If it's the government that is giving the funds, would the government need to come out with adequate funds? And that will ensure that the services that you need, when you go to the health facility, you will get it. And then there should also be protection from financial catastrophe or impoverishment associated with having to pay for health services. So here, health insurance comes in. And then cash and carry policy is also here. And then WHO is saying that they should protect guard against financial catastrophe, or make sure that people are not able to pay. The people cannot pay. The services are available, but people cannot pay. Even if they can access it, they still cannot pay. But there should be a way to protect people from that, to make so that the health service will not be worse off. People should be able to afford it. That is why there's the need for health insurance. People should be able to afford it. You don't make people worse off because they are accessing health facilities or health services, or you should not scare people away from attending to get the needed and appropriate health services. There should be a way of preventing the catastrophe, the danger that is looming, that will draw people away from getting the needed care, so that they will fall into the hands of quack doctors and other things. There is the need to guard against that. Then the issue of leadership. So that is it for the health financing. It's about adequate funds, getting adequate funds to ensure that people get the needed care that they need. And then the last one is leadership and governance. And it's very key. It's also stewardship. Leadership and governance is about stewardship, taking care of the system. And that involves ensuring that strategic framework exists. So if you want to talk about stewardship, sustaining your programs, then there should be a policy. Strategic policy should be in place. And then that policy will guide the practice of providers and then the management of the health sector. The policy should guide against it. There should be a strategic policy. When you look at the Ministry of Health, they have what you call, at times, there's this 10-year, they have a long-term policy, they have a medium-term policy, and then they have a short-term policy. So that is it. There should be that strategic policy to guide the running and administration of the system. And this policy should combine with effective oversight. Not just the policy, there should be oversight. Somebody should have oversight of or over the system. And then there should also be coalition building. You build coalition you partner with other organizations, other persons that matter, other individuals, donors, you partner with them. Like there are so many organizations that the health can go into partnership, coalition building with them. And then there should also be regulation put in place. So the policy issues are in. There should be regulation. You have a condition of service and other things. They are all part of the regulation. They are all disciplinary procedures that will ensure that people come to work when they need to be on duty. They are all part of it. If you do things negligently, what do you stand to gain? They are all part of the regulation. Then there should be attention to system design. We'll see that we've come back to the system. There should be a holistic approach to things, to the management of the health sector. And then there should also be transparency and accountability. It is also here. Whatever you do, you stand to account for it one day. So if you begin to charge people for their actions, I think the system will start running properly. You don't say that this is not my property, this is a government, so you see it to be very remote. But if you know that at the end of the day you account for it, then you take proper ownership of it. you be a good steward over it. So that is it. And then providing incentive for providers. If you want providers to give up their birth, then there should be some incentives for them, motivational packages, and users to benefit. So the users should also get some packages. When you go to Upper West and then those areas, they have now to encourage people to come and deliver. Come to the hospital to deliver. If you want them to stop delivering by the TBAs, then when they come, you should motivate them. So they have come out to that is hospital-based. That one is not from the government. The hospital has decided that when you come and deliver, they will give you Milo and other things, and that encourages them to come. So that is it. You give incentive for providers. The workers, they should be made, you make them feel good. Like now, this COVID, the government has come under the frontline health workers. They are giving them 50% increment. Then you don't even pay any tax. And I think it's a good enough incentive for them to give up their base. So that is it. And then there should also be policies that support sustainable options. There should be policies. If you want your system or the programs to be sustained, you need effective policies. You need effective policies. We are talking of social protection. Social protection, there should be policies on that so that people don't do things anyhow. If you do things and then somebody gets affected in the care that you are giving, you should know what you stand to get. So that social protection is that we have to ensure people, make sure that, assure them that the system is safe for them. And then the use of information is also key. We are talking about transparency. So information flow should be also key. And then sound financial management. There should be some financial management. Whatever funds that has been given to you, you need to manage it well based on your need as a system. So that is what the WHO building blocks talks about. So we are done with the components. So we'll briefly look at the characteristics of a responsive health system. If you say your health system is responsive, what is it? And then the first one is access. Access to services. People that need your services should be able to access it at all times. If you say your system is responsive, then the people should be able to access it at all times. Anytime I need care, I should be able to access it. And then it should also be affordable. Remember I said access has to do with funds and then geographical location. So it should be affordable to those that need the services. And then where the services are also being provided for, it should also be made accessible. If your health facility is on the top of a hill, and then the community is down in the valley, then you realize that access will be a problem. So you find a way of making it geographically accessible to those that need your services. And even the times that we open health facilities, especially when, for example, when you look at where they go for child welfare, those who do the weighing, you do the weighing weekdays. Even in the rural areas, you start by 8 and you close by 2 or 3. That time, people have gone to the farm. They haven't come. You understand? By the time they come, you have closed. So then you realize that they are not able to access. So can you make it so that maybe you wait till when they have come from their farm, and you start the services, and in that you are sure that you have made it more accessible to them. So the system will have to be accessible. And then the issue of quality of care and service delivery is also key. All the quality improvement issues that you need to take, or quality assurance things have to be in place. If it has to be washing your hands and all those things, you take the quality precautions, and then you make the system safe and the services that you are providing very safe to people. Then the user friendliness and less bureaucratic. The system should be user-friendly to people. You realize that the illiterates or those in the village, even those some people even here in Accra here, when you refer them to Charitable, they won't go because the system is not friendly there. When you go, where to even access services, it becomes a problem. When you are referred to go to the lab, how do you even locate the lab? To make the system user-friendly, you should have directional signs available at all corners. You understand? And then the service providers will have to be friendly. You put things that should be friendly. If there's the need to translate some of the inscriptions on the wall in the local dialect for people to understand, it makes the system friendly. And then issue of bureaucracy. From here, you have to go here, you go here, you go here. Can you lessen it so that you lessen the time that people spend in the hospital? And then you are sure that they will come. The demand for care will also be there. And then there's equity, the issue of fairness. In giving care, it should cut across. Even in citing hospitals, health facilities, there should be fairness in that. Those regions or areas had to reach areas that need it. They should get it. In posting health professionals, there should be an issue of equity in there. And then safety. When people come and assess the system or the services, they should not be made worse off. There was some time ago, there was this instance that somebody needed to do amputation. And then after the operation, they realized that rather, the one that is not sick, the healthy limb was rather amputated. This is a permanent damage. So even if you sue the surgeon that did it, you realize that the person is permanently damaged. So that safety should be in. The issue of safety should be in. People, when they assess the services, they shouldn't be made of, you don't come and then you trade off for another condition. So you put all the precautions that needed to be there, both for the clients and also for the providers. And then ethics, right-based approach in delivery of care. You should know that people have the right to information, and then they can also see you. Now there's free flow of information. So if you do things without any basis, and then something goes wrong, you can be sued. Like the example that I gave, that if the person was capable, that person could have sued the surgeon who did that. Yes. So these are some of the characteristics that a responsive health system should have. You should bear in mind in everything that you bear in mind, there should be ethics. And then there should be based on a right-based approach. You respect people's freedom, you respect their dignity and all that. Even if I'm an illiterate, I have some rights that you need to uphold. You should respect me. I'm supposed to be treated with some kind of dignity. You don't shout on me anyhow, or you don't beat me because I've insulted you. I am the patient, and it's because of me that is why you are there. So that is it. And if we bear this in mind, then we will know that now anything can happen. Like what happened in Confanochi, that the baby, somebody came to deliver, and then the baby died. A whole lot of issue, because maybe they didn't consider that it could be result in legal action. And then they didn't also bear in mind this right base and the information flow. They did things anyhow, and at the end, it cost the hospital a lot. Then sustainability is also key. Sustainability of your services. The services that you are providing, is it sustainable? In the next 5 years, when we come, would we see that the services are still there? Then there should also be positive attitude from staff. The providers should have positive attitude. If you are a nurse, it doesn't matter what you are going through in your home. that is your domestic issue. You should have a positive attitude when you come to the hospital. You don't bring your problems to the hospital so that you do things anyhow. Nowadays, you go, especially those who go on night, you go and then they are asleep. Nurses, they are asleep because most of them are doing part-time degree courses. So in the night, they come tired and they come and sleep. When patient needs to be attended to, they are sleeping. And because of that, people die needlessly. And then woe betides a patient who go and talk. The way the nurses will insult, positive attitude from staff. You understand? An incident happening is it La General Hospital. That the client, there were a lot of people there. And then the nurses could not be bothered. They were in the consulting room chatting with the doctor or whoever was there. So the patients started agitating. You know that community. So you know the people, the behavior of the people in that community too. So they started agitating, and then when the nurse came out, one of the patients started insulting her, and she couldn't take that insult, beat the patient in the presence of other clients. You understand? Positive attitude from staff. And your positive attitude will let people demand your care. It shouldn't be that, fine, it could be that you were provoked well enough. But as a staff in your uniform, fighting with a client, it's some way. You should have that positive attitude. If you are tired at home, you don't come and then display it on on the client or the patient. And then there has been a lot of problems with this attitude from staff, especially from nurses. You understand? But it shouldn't be. If the system is responsive, then there should be that positive attitude from staff. And then accuracy of paperwork, data, records keeping is also key. Records keeping is what will exonerate you from, in case there's any lawsuit. Records keeping will exonerate you. The Confanochi incident that I cited, because there was no proper documentation. You know that the client, the woman claimed that when she delivered, the midwife showed the baby to her, and the baby was alive. Then later they came and said, you had a stillbirth. You understand? Meanwhile, when they went into their nurse's notes, there was nothing. They didn't even indicate that there had even been any delivery there. And then even if they did, they didn't indicate the state of the baby at birth. And because of that, that midwife, those who were on duty were all interdicted. The midwife was interdicted. And then even the CEO of the whole hospital, who at that time had nothing to do with what happened, was also interdicted. So it's the accuracy of the paperwork documentation that will exonerate you from any lawsuit. And that also would, when you analyze it, will also inform the health status of the population. And there should also be consistency in service delivery. That also ties in with the sustainability. The sustainability of your services and then your programs. And it also ties in with the reliability. Your services should also be reliable. Courtesy and helpfulness. As service providers, you need to be courteous. And then you also can go out of your way to do that extra thing. Go out of your way, do that extra thing for people. And it pays off, not in monetary terms, but it pays off if you give care to somebody who recovers. And then you know that you've done that out of your will. You get fulfilled. So courtesy is key. At least, even if you are angry, be courteous to people. Be courteous to the clients. You don't just talk anyhow to clients. And then you need to also help people. Then there should be speed and timeliness of delivery. We are talking about people's health. We are talking about emergency situations. You know health, every minute counts. Every minute counts. Every minute somebody is surviving, somebody's life depends on that. So that issue of speed and timeliness is key. Whatever you are doing, there shouldn't be any delay. But there has been instances that providers, we delay, especially if you have been to the labor ward. That place is worse. Especially when you are going for CS, which is supposed to be an emergency thing. They will put you on a stretcher and you'll be lying down there. And the midwives, the nurses, the doctors in there, they don't even, I don't know, they are not bothered. You will be there till they finish doing whatever they are doing. And anything can happen. If it's a ruptured uterus, it could have happened. Anything. So issue of speed and timeliness is key. And then punctuality. If you are supposed to be at work 9, you should be there. You don't take, I don't know how to put it. But we take our time and then we'll go to work anytime that we want. After all, it's government work. Whether you work or not, you'll be paid. But if the system is such that if you are late 1 hour, you fulfilled your salary, you will sit up. Yes, you will sit up. So these are the characteristics of a responsive health system. So thank you. This is the end of today's lesson.